Hello, so welcome along. We're the Script Physio. I'm Kaz. How are you going, Bowie?
I am wonderful. Sunny day in Perth. Just pumped to have a bit of a conversation about physio things with the one and the only Dr. Kieran Richardson.
That's right. What an interesting guy. He's such a thought leader in the space of non-operative knee approaches. And he also runs a really successful business where he mentors other physiotherapists and provides a lot of training and resources for them as well. He's got a lot of interesting perspectives on our profession, hasn't he, Bowie?
Yeah, he's just a super nice guy. He just exudes that kind of like support and, and humbleness around him, even though he is very overly qualified. But yeah, he's such a nice guy. Really just willing to share all his opinions and things. Yeah, looking forward to having a conversation.
Let's get stuck into it.
All right, we are here with the one, the only Kieran Richardson. Kieran, thanks so much for being here. Super excited to kind of just talk physio things today, super casual. Who knows where this conversation is going to go? If any of our coffee catch-ups are an indicator, we're probably going to be just talking some random shit. So yeah. Let's get into it. So
let's start with the formation of the universe. So where do we? No,
love that.
There were two particles
conversation
that crashed together.
Knowing you, Kieran, you probably have a good answer for that. Like to go
well,
do you want
to start metaphysical, or do you want to go like even zoom back from there? No.
Yeah. How does the ACL represent the world? Yeah, look, man, let's go. Let's see who knows where this is going to go. But we're going to talk for those that don't know you, which I know a lot of physios do, and they're very lucky to. Tell us a little bit about who you are, where you are, and what you kind of just do.
Okay. Yeah, sweet. So, look, for those who don't know me, I'm in my 40s now, based in Perth. Grew up in New Zealand, youngest of three. Maybe we could talk about the psychology of birth order, because there might be...
Yes.
there's probably...
I'm the youngest too, so I totally get it.
Okay.
I'm fourth. So I don't even get like a title. I'm 4 out of 5. So I'm like the lower quartile.
Well, there's this funny meme where it's like first child eats dirt, rush them to hospital. Second child eats dirt, scoop the dirt out their mouth. Third child eats dirt, wonder if they need lunch. Like, so you sort of feel a bit neglected. So maybe that's why I'm trying to like always get myself out there.
I love this. Let's turn this into therapy. I love it.
Yeah, it's basically, well, you've got the couch there, so.
Yeah, it's true.
But basically, yeah, so I studied physio in the early 2000s, did a master's degree. Then I did a postmaster's doctorate fellowship, and now I run a consultancy company where we train physiotherapists from early stage all the way through to trainee specialists, but also PhD and some clinic owners and like senior clinicians. And we also give second opinions to patients. So that's what I spend my time doing now.
Awesome.
It's impressive how you've got the trifecta of qualifications. You did the bachelor, headed straight into the master's, and pretty much straight into the specialist.
Yeah.
Maybe the child order is our clue.
Yeah.
But what was driving you? You really barely graduated before you were like, I need more of this. What was behind all of that?
Well, that's interesting because I actually, when I first graduate, well, actually just before in my final year of study, I had a really, really bad placement where this particular tutor was very savage with me, very authoritarian in her style. And she said to me, your knowledge is so superficial. I don't think you're cut out to be a physio. And like, it really hit me. And like, she was very strict with how she said it. And I just passed. And so I was quite bewildered, to be perfectly honest. And then fortunately, the next placement was an MSK, musculoskeletal placement, and the tutor was very relaxed, and he was much, much more complimentary, and actually said, you're one of the best students. And so, like, it was kind of, I had gone into that placement thinking, I'm maybe I'll complete the degree, but I don't know if I'm ever going to use it. And so that happened, and then I wasn't sure what I was going to do. Like, even after graduating, I wasn't sure whether I was going to go and do change career. And then the first place I worked was a hospital, and my boss was also very chilled. And she said, look, you can basically just take your brain out and chill for the next 2 years, which was really good for me. And so I just spent time just like, and she was a fantastic mentor. And then I had a great clinical mentor who was the same, just let me just kind of learn at my own pace. But I never felt like I could, because back then, to get into physiotherapy was harder than medicine. The score actually was higher back then. And so I didn't get into physio first off the bat because the score was like 98.5 or something, ATAR or TE it was called back then. And so I had to kind of go the back route, did a year of a Bachelor of Science, did very well at that, and then got an interview into physio. So I've always felt like maybe an imposter syndrome. But since then, I've just, the clinical doors have opened for me. So I can unpack that a bit more. But yeah, I've always felt like maybe I didn't cut it.
Yeah. It's amazing to hear, right? Because like I think I've talked to some young physios and students, and yeah, I aspirationally want to be people like yourself, Kieran, and you just assume that along the way, so they're kind of touched by the physio, gods, that they have this knowledge sense. But it's really lovely to hear that that there's been struggles, but there's also been that kind of passion to drive through it.
Yeah. Yeah. It's kind of just almost serendipitously, I've just had these incredible mentors throughout various stages of my career, and probably why I now have a bias towards mentoring and run a mentoring company, because I needed people to see in me what I couldn't see in myself. And so I definitely know that imposter syndrome concept. And even after in my first couple of years, so I worked in the hospital for a couple of years, then I worked in private practice for a couple of years, and I still didn't think I cut it. I was thinking of moving into medicine, actually, or law. I'd sort of, like, those doors had opened up, and then I just had another private practice boss hire me as a senior physio because he saw me as an educator, and I was like, this guy's crazy, but I'll give it a go. And then the masters opened up, Karen, so he let me kind of do that part-time. And then I just, once, because in undergrad also, like, my grades weren't the best. Like, it was kind of like a P's get degrees scenario. And then when I did my masters, I just took to it like a duck to water, and I was like near the top of the class. And then in the specialization, I was near the top as well, because I just had found my lane.
I love a leadership origin story so
Yeah.
much, and it makes a lot of sense with how far you've come, the people that you resonated with along the way as mentors. Do you think those mentors were like you and that's why you resonated with them? Or were they just good at seeing and knowing what you needed and meeting you where you were at?
They definitely saw something in me that I didn't feel I could see in myself. So I remember the first hospital boss manager, she was quite diminutive in stature, but she had this kind of like edge to her that you didn't want to cross her, and particularly as an advocate for the profession. So she would like go into bat for us if a patient made a complaint, or if the hospital was trying to like shimmy physio off to the side and like downplay our role. She would like go into bat against surgeons, go into bat against, the hierarchy within the hospital. So there was a part of that I really connected with and liked. Same with my clinical mentor in the hospital. She was much the same. She would kind of like tell the consultants they'd got things wrong, but she was fearless. And I really loved that. I thought that was really cool. Like, just that the necessity of physio within the healthcare model, they definitely saw that. Much like my first private practice boss, he was the same. He kind of had this, he would go and educate the GPs next door. He'd run these education sessions, and the GPs would just be sending him heaps of referrals because he clearly owned the MSK space. So I think that I've always found, maybe they saw that in me as well, but I definitely found that attractive in them. Yeah.
But the advocacy was a real part, and
Big time.
that's so interesting because you're a huge advocate in our profession now.
Yep.
But it's like
Yep.
you felt good about yourself and doing your job when somebody was backing you. You had this confidence that they were backing you. I love that.
Yeah.
Yeah, I think you kind of what I was kind of hearing as well is that, and I will talk from a personal point is the sense of safety, right? Is that
Yeah.
you can have growth as an individual if the people around you create a safe work environment, and then you can flourish. And just to give Kieran a little boost. So Kieran was my mentor in my first 2 years out before I started doing my master's. And so creating inquisitive, safe space. But I came to Kieran and I said, I'm thinking about doing medicine. I'm kind of frustrated in physio. I don't know, what's next. And his question back to me, it was very lovely. It was kind of this kind of thing of like, yeah, okay, like I totally get it. What's the hope? What's the dream? And I was like, maybe to kind of become a sports physician. And he was like, well, like you can go back and you can do all these years. We kind of end up kind of doing what you're already doing. So maybe we should just do what you're doing really well. And it just had a bit of a mind shift, but it created a safe space, and the safe space allowed a lot of growth, which we can kind of talk to the non-safe space that exists online around
Yeah.
physiotherapy.
Yeah.
And so it's just an interesting kind of juxtaposition between, like, if we want somebody to develop, we need to create the space.
Yeah. And like I have done certificates in mentoring and feedback, right? And so the way that first tutor spoke with me was like an adversarial space, like the opposite of a safe space. Like it was like I went home depressed space. And but that was actually it's quite a traditional method of teaching within medicine health, where it's like tip the knowledge into the person and like, this is what you got wrong, as opposed to how did you think you did well in that session? Like what things stood out that you did well? And so sometimes when I'm presenting that to a mentee, they'll go, they thought they were about to list all the things they did wrong. You're like, no, you did heaps right. Let's focus on what you're doing well. And so like there's a method of mentoring called the Pendleton method. And then that actually helps the learner have a better, that they're going to grow more than just feeling like they're getting schooled. Right. But that's like you mentioned online, that's the thing that frustrates me. Probably one of the most frustrating parts of being within the physiotherapy profession is it is so self-critical. Like, I don't know if there's a profession that's more self-critical than physio, like certainly more than medicine. And some of the online voices are particularly hostile. And so to try to bring a positive spin within the profession, but then also advocate for what we're doing externally, I find that's very frustrating for me when the physios don't even believe in themselves. And so, yeah, I hope that that's part of what we can do.
So that's a good point there. And part of what Bowie and I want to do here is break down a bit of that sort of, well, we sort of say the ego in the profession, but actually it's probably ego grounded in that lack of confidence. There's this sentiment that you have to know all things about all injuries at all times, and that makes people feel really out of their depth. So sometimes that can then be disguised by a front of bravado. How do we chip away at that, Kieran?
Well, look, I was a bit like that because I wanted to portray confidence. We all do. But I simply just wasn't experienced and trained. I just had to realize that I hadn't seen enough cases. I didn't have enough knowledge because A, I hadn't completed additional training, but B, I just didn't have enough experience. And so I think that's why the mentoring relationship's quite beautiful, because I'm not there to try to show them how smart I am as a mentor. I'm actually as a peer coming alongside to work together. And oftentimes the mentee is telling me things that I'm like, yeah, I probably should have thought of that. It's more collaborative. And I think there's a couple of papers that talk about, we can give lectures, and I love giving lectures and I love running workshops, but one-on-one I think is very good. It's very it is very safe, and you can be yourself. And so I think that's why I've personally, that's where I learn most. Like even with I've got a mentor now who's 25 years older than me, and he teaches me a lot about life and just his marriage and his goals. And he's like, it's whenever I meet up with him, it's like an injection for me into my soul. And I hope that that's what physios get when they connect with a mentor who really wants the best for them. Yeah.
I think it's such an important point, because I feel like, and this might not be unique to physio, right? Is people go through a career and have ebbs and flows of ups and downs and passion and frustrations and feeling sometimes just being stuck, um, and it can be tricky. And you've talked a little bit about with mentoring, but do you feel like there's any other like if there's a young budding new physio and they're just kind
Yeah.
of feeling stuck in the profession, like
Yeah.
what's the secret sauce? How do we kind of keep moving
Well,
forward? And have you experienced those moments where you're just
absolutely.
like annoyed at physio? Like I get it sometimes.
Oh,
I'm just like, oh
every
guys,
day.
let's just come together.
Yeah, I
Yeah,
do. It's actually interesting. Like, there's a lot more scope now, I think, than when I first graduated. It's like 20 years ago, you kind of had limited options. I think the options are much more broad, and obviously through global, we do online and in person, like teaching and second opinions. But I think for physios, you don't just have to be like one path. You can kind of be a shapeshifter. And I think that's what both you guys have done as well. And so it's very sad for me when physios would think that they would burn out and get disillusioned with it. I think a key message for me is that we are a necessary role within the healthcare system. And I think that we have to get physios to see and believe that. And if they don't see themselves as necessary, and some of the messaging I hear online, like particularly from the antagonists within the profession, it's like, we're just sort of mollycoddling the patient through natural history, which is just untrue. And so I hear a lot of that stuff, and I can see some physios see that and they're like, oh yeah, we're not really doing, we're not changing anything. And I think we've got to push back against that narrative, I think, as leaders within physio, in my opinion. Yeah.
I think your it's interesting that you said how much physio's changed over the last 20 years, and in a particular area of ACLs and non-operative ACLs, like you have
Yeah.
been quite a large voice for this. And we don't need to go down the pathway of talking about the research. Listen to one of all the other Kieran podcasts that are out there about that. But let's talk about going against the grain.
Yeah.
Fighting kind of the good fight with
Sure.
these types of things, and what that looks like, because it's really challenging if 90% of people are telling you that you're doing the wrong thing.
Yeah.
So can you talk a little bit about your experience going through that?
Where do you want to start? Like what?
Well, yeah, so
There's not literal
obvious.
fights. Like, I'm not getting in literal fights.
I would love to see that though. Some just like back alley, the ortho ding 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 kind of coming
The
in.
author, I'm bringing my fists to a knife fight.
Yeah,
Basically.
exactly.
Yeah.
I'm
Yeah.
curious about like why this ACL stuff. I suspect there's a degree of like, because it was against the grain, it was a bit appealing to you. So what
I-
what
yeah.
led to the rabbit hole?
Uh, I've been quite comfortable, even amongst my friends at university. Like, I was within the crew, but I was a bit of an outsider. Like, I've always been pretty happy. There's a song, there's this one group that I like to listen to, and they say, as an outsider, you're free to roam, is what one of the lines of their song. And so I think when you're deep within the system, it's hard to think as a contrarian. So I always and obviously I like giving counter perspective. Just that's what my training's been in, and that's something that appeals to me. And my wife's the same in her line of work. And so I've always found just considering the counter perspective really interesting. And I figured that there was a reason why I stayed in physio, and probably later in my undergrad, I did this work placement where the practice owner said to me, I want you to create a flyer for non-surgical knee arthritis management. And I was like, okay. And so I looked into the research. This is like early 2000s. And there was research then, even pre-GLAD, that physiotherapy could delay or prevent a knee replacement. And I read that. I was like, that's so cool. And I remember telling patients that who maybe had the diagnosis of arthritis that they could get into an exercise program and it could. So I'd sort of seen that earlier on. With the ACL thing, there's a succession of events, but basically I just started to look into the research in other jurisdictions. So in Scandinavia, they have a different model of care. And so the specialist physiotherapists there are called orthopedic non-surgeons, and they actually triage to the surgeons. So sort of like an extended scope or advanced scope practitioner here in some centers, they'll like triage to the consultants. That's mandatory there. So everyone does like a physiotherapy first approach in Scandinavia and Northern Europe. So I've been there and visited, met the surgeons, met the professors, and it's a very different system. And I think in many ways it's better and superior. And having been exposed to that model and then looking at our model, I just realized that there's some large gaping holes within ours that physiotherapy has a great place to plug ourselves.
I think it ties together beautifully, those two things. First, it seems like the theme in your career has been seeking to see the real value and where we fit really well into the health system, intersected with that kind of going against the grain counter view sort of stuff. And you've certainly become known in this space globally. And you mentioned sort of drawing on the models in Sweden, but what about when you zoom out and the conversations that you're having with different professions similar to physio around the world? How do you navigate conversations in places where perhaps they're not as open or receptive to the non-operative approaches?
This is where it gets interesting, because it's multi-layered and it's multifaceted, and it's easy to swim downstream. It is easier to swim downstream. It's harder to swim upstream. It's at times awkward. Like, I've been in conversations, you can cut the tension with a knife. And there's various reasons for that, because if my views are taken to their extreme, I could be seen as a competitor or someone who's actually trying to usurp a system, which is not what I'm trying to do at all, or what we should be doing as physios. But it's a delicate balance of seeing ourselves as a necessary expert within the healthcare system, but we don't want to unnecessarily denigrate other professions. And so, there's some language that we can use that makes it less hostile. You don't want to tell someone who's spent 15 years perfecting a surgical technique that their technique is no better than placebo, because it's too much for them to deal with, because even if we mean it well and we're basing it on the best research, it's offensive to that person. So we have to be careful with how we communicate, especially online, because they might not, like, at least even in this setting, you can see my body language. You can see how, if I'm just saying it in text, or if I just drop a study on someone and say, you're a placebo surgeon, like, if I say that, then obviously it's going to be interpreted as hostile. So physiotherapists have this tension of working within the healthcare system, creating streams where we can actually go directly to patients, because we may be the only people who are offering them non-surgical management, but then finding like-minded allies within the healthcare model who see our view. So that's a part of it, but it goes a bit deeper than that. But that's where I start a lot of the conversations, because I've been a part of interprofessional discussions, interprofessional debates even. I don't like debates because that just tends to polarize everyone. The discussions, I think, can really advance the topics, but there's some sectors where you don't really want to go down. You don't even want to engage with some people because they're never going to change. Yeah.
It's so interesting watching you interact online, Kieran, through social media and through presenting. It's really making me realize that you word things so well and so considerately, because you don't want to be to other health professions what that first clinical supervisor was to you.
Yeah.
Everyone's welcome here. We can all have our opinions, and let's just see what is best for the patient.
It's definitely, I have got it wrong in the past, for sure, because you will engage, it's just this, you just find this in life, like whether it's politics or whether it's religion or whether it's, just personality types. Like, there's some personalities that you just don't connect with them. Like, they're just abrasive, or they're like, they have just they're going to die on that hill. Like they're just on their deathbed. They won't renounce their view. Like they just have that view. So there's no point. So like in the past, and there's a part of me, maybe it was because I'm the third born who's like always trying to get the attention. I'm just like quite like prodding those personalities because I like to just unruffle them. I just like to ruffle the feather, tickle them, not like aggressively, but just tickle them a little bit just to see the reaction. So, but I know that that's not always good for the greater good. So it's like, yeah.
So look, you've had a lot of experience with these, these kind of difficult situations. So conflict is something that I find kind of interesting within professions, but also between like with the patient, right?
Yeah,
Is sometimes, wouldn't it be lovely if we walk in every day, patients are super excited to see us, and they've done everything we've asked them to do, and they're like, "Yep, life is is great."
Yeah.
Having been through a lot of it now, and kind of thinking back to the younger physios that are coming through and dealing with conflicts, which can sit really unsettling with some people. Like it can be hard if you conflict with somebody.
Yeah.
But part of our profession is sometimes we have to conflict beliefs. We have to conflict with understanding. How do we start getting better at conflict?
It's kind of picking the battles. I think as with talking with physiotherapists and patients, I think sometimes with the patients that there's no point trying to get the patient to adhere what we're going to say if they're not ready. That readiness to change model. And so like there's sometimes I'm looking at the patient if I'm doing a mentoring session with a physio and it's live, like there's a patient in the room, and I can see the physio's frustrated because the patient hasn't done their exercises, but the patient's getting better anyway. So it's like, well, who cares? It's like, well, it just might take a bit longer. And the patients don't care, but I can see the physio's frustrated. It's like, well, I think going back, like one of my mentors, he was like quite brash, and he'd sort of say stuff to the patient. He'd go, you know what? We as physios, we want this fixed right now, but we're happy to take another few months. Are you happy for it to take a few months? Patient's like, yeah, for sure. Like I think the physios as perfectionists really want to fast track the patients. But if you look at, depending on the condition, depending on the case, but I would probably give myself a lot more grace. And I try to give the physios a lot more grace now and the patients, just that stuff takes longer, stuff's slower, they ebb and flow. It's not my job to fix the patient. I will work with the patients, and I'd probably just try to let the physios work with the patients longer over time now, especially around beliefs. You mentioned beliefs, like unless I really think the patient's about to make a very silly decision, in those moments I will confront strongly, but I'll still let the patient make the call. And so there's some circumstances where if I'm doing mentoring, say with a postmaster's physio, I call it like the fork in the road analogy. And there are some cases where you have to go, look, if you do this, you can't turn. This is the nuclear option. You're about to push a button you can't reverse. So there's times I think you have to do that, but they're the lesser times. I think more often than not, I just let people take time, and I'm not too pushy probably as I was earlier.
So something that you said right at the start, right, which I absolutely love, is we asked you about you, and you started with like, I'm in my 40s, I'm doing I'm the third child. You didn't start with, I'm a specialist physiotherapist. You don't really identify yourself as your profession. And so I think having this dissociation is so important for us, because like if you have a conflicting day at work, or you have a patient and you've alluded to like sometimes things don't go the way that we always want them to. Like I think the other side of being a clinician is how we unwind as a clinician and how we can learn and let things go. Like, so what's your go-to? How do you manage, the hard days?
Yeah. Oh, look, especially once you start adding in relationships like a marriage partner who can clearly identify all your flaws, or children who know how to like poke those nerves. So
Especially
get ready for that. Get ready for
and
that.
Probably
man.
learn from their dad, to be fair.
Yeah, true. They probably learn from. Oh, they do. They're like I can see they're like little Kierans running around, and yeah, they're funny. But my wife and I have found just what you said before about how some physios tie up their entire identity in the profession. I don't think that's wise. As much as my head pops off the pillow, pumped for the work day that I'm about to start. I I work hard, but I play hard and I rest hard. So I think physio, and I see it in some other professions where the person's entire identity is tied up in their job, and I don't like that as a long-term life philosophy. I think there's times where you have to work hard and times where that's important. But for my wife and I, we've built in what we call mental health time every day, which is like an hour where we just do whatever we want. And then we have an hour of exercise a day. So that's really helped. Obviously, but I'll do strength training. I'll do hybrid training. I'll go for a walk for an hour. But then like yesterday, I got a massage. So that just helps me wind down. So I do that plus meditation, this kind of thing. So
It's so good to hear that. It's so important to weave in that balance. And now, as a mentor, you're able to really introduce that concept in early for young therapists.
Well, I had one physio we started mentoring who was still mentoring. She is an absolute weapon. She is on a trajectory to become a guru. I can just see it. But she was going home and spending 3 to 4 hours a night doing her notes. And I was like, this is not going to work. Like, this is something you need to change. And she was like really wanting to make everything perfect. And she was running late and she had these. So that was something we had to make a big shift on, because I could see that was then carrying over to these other parts of her world. So I think, yes, the profession and what we do is just beautiful, but if you're out of balance and out of kilter, then there's no point, because it's not sustainable. Yeah. So you want to have a good balanced long-term trajectory, I think.
Yeah.
I'm curious if there are any other recurring themes that you see in junior therapists of things that they're facing. Now, do you think that any of that's linked to holes that we have in our education at uni, or is it just that they're in a process where they need to develop those life skills?
That's a great question. I think with physiotherapists, like the type of job we do, obviously, and the type of person that's attracted to physiotherapy, they're normally pretty successful academically. They're normally pretty popular. They're normally high achievers. So that can be a recipe for burnout if it's not in balance. And I think personally, I've always said we probably can't get into it today, but I think the undergraduate is too short. At least when I went through, it needed to be we had too much content. There's no way I was going to remember half the stuff we covered. But then we're kind of thrown into the hospital or thrown into private practice, and you just feel in over your head to be dealing with patients. So, I think in psychology, they almost have a better model where you can kind of move into that become a clinical psychologist takes a lot more than just their undergraduate. It almost should be like that for physio. And I think a lot of obviously a gap that I've seen is that a lot of these clinics don't have good new graduate or recent graduate training. So they may just think that the physio is going to pick it all up. But if you're dealing with patients and then trying to upskill, and then you also you may have some issues going on at home. Like if you've got that, it's a very volatile mix, I think. So there's definitely gaps. There's gaps that are still there now. And there's a lot of anxiety. There's a lot of anxiety in the world, but also in this era, I think, compared to when we graduated, or at least it's more known now.
Yeah. I think, like a lot of people listening will first resonate with the fact that we are all popular and successful and relatively, I think I like both Kaz and I were both like nodding and we're like, yes, that does sound like us. So thank you. But I think, it's, to find a good mentor is such an important thing. And so supporting the individual, I hope that we continue to find these processes to help. But bigger question now, and I know we like taking a little bit of humor as to support the profession. Here we go, leaning up to no, but like kumbaya moment. How do we bring the whole profession together? Like going forward, if you could just get on with your picket, little picket sign and say to everybody, this is what we need to do. Like, how do we start moving forward?
Well, I have done it before. Like I did a presentation for the APA once, and literally the entire presentation was memes. And like, I thought they're going to hate me for this, but I just did it
Love
anyway.
this.
And I got good
we need
feedback.
more memes in the physio
Yeah,
profession.
Memes. There's actually this paper. There's this paper called "What Do You Meme?" It's like the science behind memes. And so like I've given this serious presentation once and like pulled up the study, and I'm like saying this is actually something we need. And like I could see the academics in the crowd were just like shaking their head like, who's this guy? But I think like, look, there's clearly, as a profession, we have so much to offer. Like I think of it as, you know, what is, especially in MSK, what are the things that the patients are going to get in the traditional medical model? For MSK, they're going to get drugs, injections, scans, surgery, maybe on referral to other medicine. What can physiotherapy offer? We can offer elite education, potentially hands-on, specific exercises, and we've got time to walk the patients through the journey. I don't think we have to clash with medicine, but we have to see that in a majority of cases, those things are best for what we offer is best for the patient first. And I think we have to agree on that as a profession. Most physios that I meet, they agree with that. They agree that what we can offer is at least as good in many circumstances for the patients that would have pain or injury first. And I think if we can agree on that, then the nuances of it, you know, the manual therapy thing, I think is, I think it's a side, there's a lot of like debate about manual therapy, and I run manual therapy courses, but when I'm doing the courses, I'm thinking this is adjunctive. This is a side debate. It doesn't have to be oftentimes physios like, oh, there's people doing too much manual therapy. It's like, well, maybe, but how can we big picture help in healthcare? And I think seeing the value of what we offer, and that's just not in MSK, but that's like if you take that same lens and put it in women's health, men's health, geriatrics, disability, like we have a necessary role. But if we have to get the physios to believe in ourselves, and then we have to get them to communicate that to other professionals, and then sometimes just directly to the patients, because we may be the only people who are going to communicate it. That's how I see it. Yeah.
Look, Kieran, we could talk all day about these different things. I think it's been absolutely wonderful to kind of dive into, I guess, just your lens of kind of how you view the world a bit. It just exudes positivity, and I'm sure all your patients, but I think all the physios feel it as well. When we have these moments of chatting and discussing these things, it uplifts you, and this is what we want with this podcast, is just to kind of pull the curtain back a little bit and be like, look, we all have difficulties, we all have struggles, but this is how we kind of bring things together rather than picking a fight over something that's not important. So thank you so much for taking the time to show us the man behind the legend, and make us all feel wonderful.
Like the Wizard of Oz scenario. Like
correct.
Like it's not.
That's
like
it.
let's look behind the curtain. His room, his house is messy. There is like random. There's like random
Wow.
clothes. There's like laundry that's not done.
The expert in
for
his
a
natural
moment-
environment.
For a moment, I thought he was going to show me the red shoes that he has on his feet that he clicks together.
Actually, these shoes, just on that topic, I have these shoes that I wear, right? I wear these shoes. They're like, I don't know if this is like,
Ooh,
I
we
don't know if
love a
this is gonna-
slide.
they're actually Birkenstocks, right? And so I actually wear these shoes, and it divides, whenever I wear them as a part of a presentation, that they divide the room. So I like having a polarizing footwear just to like I think
Just
that
to
can
start
potentially
it
bring
right in
people
the middle.
together as well. Yeah.
Mm.
Love it. Wonderful.
I'll jump online and go shopping right now.
Yeah. I think we're going to need another 40 minutes just to discuss footwear with Kieran and
Look, I
get
don't know if
people's
this is
views.
like, I don't know if this is what you guys wanted, but I don't know.
No, this is perfect. I love it. Wonderful. Thanks so much, Kieran.
It's not what we wanted, but it's what we needed.
Yeah, exactly.
I'm not the hero you want, but I'm the hero you've got.
Love that. Hope that's the tagline on all of your business cards. Yeah, look, it's been wonderful. I feel like we're going to have to come back and have another couple of 40 minutes to discuss some other topics along the way. But really
Sounds good,
appreciate your
mate.
time. And yeah, can't wait to get people's feedback on all these different things. And it's I hope it just fills people's cups up a little bit as a physio and feels like they can kind of join together a bit more.
That's good. That's what
the
we
way
want to
we
do.
look at physio.
I
Yeah,
think
awesome.
so. Yeah, great.
Kieran,
Thanks,
you're a
Kieran.
legend. Thanks.
No worries, guys.
All right. Wow. Just so great to listen back to Kieran Richardson's podcast there. I remember feeling so buzzed after recording this that I just went for a run and I was spinning ideas and just kind of feeling really connected into the profession and the positivity of feeling as a physiotherapist in our world. So awesome. Massive thank you to Kieran. Absolutely loved it. I think, my takeaway themes talking to Kieran is really about the support and the network that you get. If you surround yourself with positive people that give you, that feed back to you positivity, you feel inspired for innovation. You feel inspired to go against the grain, to engage, and you get a lot more joy out of what you do. So I think that was wonderful. I really enjoyed that conversation. I think as well, I'm really excited because it kind of encompasses what we're trying to do here. We're not trying to come up with some magical next best thing in physiotherapy. We're just trying to create a bit of a connection and engage with our profession and create a positive space and a safe space for conversations so that we can kind of move forward together and support people to become the best clinician and when they're going through the highs and the lows. So, awesome podcast. Loved it. So one of the things that we do here at Off Script is we really value our guest time and the fact that they come on just for the betterment of our profession. And so we ask them to nominate a charity and that we do a donation to that charity and highlight them. And so Kieran has nominated Destiny Rescue, Rescuing Children charity. Their tagline here is "We rescue children from sexual exploitation and human trafficking and equip them to stay free." So I think a wonderful charity. Again, I can't say how thankful we are for Kieran as well, giving his time. Really excited for the upcoming season and all the podcasts that are coming up. We've got some wonderful people, some really interesting conversations. Looking forward to kind of engaging with some of the listeners and getting their thoughts and seeing where this journey takes us. Kaz, you're a superstar. Thank you. I can't wait till next week. No, thanks. I try. Awesome, guys. Thank you so much. Really looking forward to seeing you next week. Signing off.
Thank you. See you next week.